Hi, I wanted to make a brief video and just discuss some concepts that I found it difficult to obtain really concise, pithy articles about. So first, I just want to say that as we look at this particular week's lessons, we're looking a lot at therapy. However, the insights about therapy are true regardless of the intervention that you're doing. So if you're doing a peer support program, if you're doing an educational campaign where you're going into the home and talking to people about some psychological issue, even if you're providing food or clothing, those insights about common factors are going to be helpful for those programs as well. So even if you're just going in and you're providing some additional food, let's say, it's important to know that the providing of the food is probably, that's sort of the specific intervention. That's probably the least powerful thing you're doing. It's the other things that surround that. It's building a relationship. It's letting people know why you're doing this. It's seeking feedback from them. Those are the components of the intervention that are likely to be most powerful. So that's one, is that although we're talking about therapy, we're talking about all different kinds of psychological and mental health ministries that could be occurring for either from a church or from some parachurch organization. That's one. Two, I want to talk about attrition. Attrition is a word that just means drop out. And dropping out of interventions is a huge problem. I've worked with ASU on a number of projects where they're doing, for example, parenting classes, and they've shrunk the number of sessions because they've seen what an issue attrition is. They began with a 9-session program and they shrunk it down to 4. And even within those 4 sessions, they see attendance high at week 1, week 2 it goes down. Week 3, there's a bigger drop, and then it kind of perks back up around week 4 as people are reminded it's the last week and we're handing out certificates. And so this issue of people dropping out is huge. If you look at the literature on therapy, the modal number of sessions that people attend is 1. So the thing that happens most often is people go to 1 session and then they stop going. For those who stay, there tends to be an uptick. For those who stay and those for whom therapy does work, there tends to be an uptick in their mental health, quite significant over the first 3 sessions, pretty significant over the subsequent 3 sessions, and then after 6 sessions, it starts to level off. However, the research does show that people who stay in therapy for a longer amount of time, say a year or 2 years, are the ones who get the most benefit from it. So I think that's important to keep in mind as you're looking at doing some kind of mental health ministry. You're going to have to address the issue of attrition and figure out what are the factors causing attrition in your particular program. Those could be transportation. They could be time. They could be that the program is not perceived as valuable by people. And so you need to be looking at the feedback and see what you can do to improve the program. And it could be that people feel significantly better and then they just kind of don't want to go because they feel significantly better. We know from the research, though, that having them attend more sessions is good, and so we should try and encourage that. So attrition, just wanted to bring that point home. People drop out way too often and way too soon, and that needs to be a major focus of any kind of mental health ministry that we do. Then the final thing that I want to talk about is called iatrogenic effects. Iatrogenic effects refer to the phenomenon that people get worse because of the treatment, and we need to consider that. Now, as we saw before, treatments that involve coercion or challenge people, or they confront people, confrontation or coercion, those treatments in general make people worse, but any kind of treatment can make some people worse. If you prescribe somebody a pill for pain, some people might become addicted to that pain pill. That's an iatrogenic effect. In terms of psychological interventions, having someone come in and treating them like someone who is helpless, giving them a diagnosis and not much hope. These are things that simply coming in and talking to you or coming in and interacting with your program might make the person worse. The other thing that can happen is maybe this program is not right for this person, so they go in and they don't see any improvement and they get demoralized. That's another way it can happen. As I think we talked about this in an earlier session, get a bunch of delinquent kids together and they start to feed off each other, and their peer interactions where they're reinforcing being snotty and disrespectful and antisocial is more powerful than the effect of the person who's the adult who's trying to deliver the intervention. That's another iatrogenic effect. And I think it's important as we look at things to keep in mind we need to be using that feedback to identify people who are not getting well or who are maybe getting worse. And then we need to adjust. If we're really taking the role of a servant and we've brought metaphorically some item to the people that we're working for, the people that we're serving, and it's making them worse, we need to maybe remove that thing and as servants bring them what will help them, not necessarily what causes our program to flourish, but what's really going to be helpful to them. So those are the three things. I wanted to talk about the fact that even though we're looking heavily at therapy here, these insights are important to any kind of intervention. 2, we need to really keep an eye out for attrition and dropout, make sure that people are attending the program and getting the best benefit they can. And then keep an eye out for iatrogenic effects as well. We want to make sure that anyone who's not getting better, or definitely those who are getting worse, are getting some kind of change, and we're changing up what we're doing for them so that what we're doing is not causing them harm. Thank you.